everybody. Welcome to this month's Talks with the Docs, and we are going over hormones, hormone balancing, what that means in Chinese medicine. And then I'm going to go over a little bit about the Western mindset, how the HP Access works, some exercises that you can do at home, and acupuncture points that you can do at home to kind of help balance your hormones in a proper natural way. And then if that is a little bit too much, or like if your hormones are a little bit too much off, we're going to give you some resources that are out of our scope of practice, but still very useful for patients to do and use that can help you. So welcome. I'm Dr. Kelsey with Sacred Chiropractic and Acupuncture in Kansas City.
And I'm Dr. Karen Williams. I'm the acupuncturist here at Sacred Spa and Wellness right outside of Saratoga Springs, New York. And we're here to talk about hormones, Dr. Kelsey.
Yes.
Okay.
And I'm Dr. Abby. I'm Dr. Abby, and all things sacred. And I get the joy of being the attendee today. And so I'm so excited to see what these girls have prepared, and just both a wealth of knowledge. And so I'm excited to share this on our YouTube, Love Sacred. And so I hope everyone enjoys their time watching.
Welcome, everyone. Welcome. This is going to be fun to have everyone here. And we're chatting today about hormones. So hormones they're very sensitive chemical messengers that coordinate various functions of the body. So they're responsible for sending signals to the organs, the muscles, and other tissues in the body. And basically, these messengers tell the organs what to do and when to do it. So hormones, they're in control of many of the major processes that go on in the body, such as metabolism, reproduction, mood, our circadian cycle as well. It's very important for, sleep and wake cycle. And in general, our overall health. So the hormonal system, it's very delicate. So if there's a slight increase or decrease in one of the hormones, this can result in major shifts in the body. So some of the shifts, they can be temporary, or if there's a slight imbalance, it could be due to, say, like pregnancy, or you're going through a stressful time in your life. But most times, hormone imbalance is occurring over a period of time. And this can be due to factors such as diet, having a poor diet, excessive exercise, not exercising enough, illness such as autoimmune disease, or exposure to toxins. Prescription meds can even cause an imbalance as well in your system. So, and it can manifest differently for different people. So, for example, it may manifest for someone as low libido, or it could be food cravings, or weight loss, or weight gain, or they're feeling anxious, they have a lot of anxiety. So it can manifest as in different ways for different people. So it's not a one size fits all. And that's where Chinese medicine comes in so wonderfully. It's just great because it customizes, it looks at the person, and it really customizes the treatment and how we approach treatment for each individual. So let's talk about what hormones are in Chinese medicine. So in traditional Chinese medicine, the kidneys are the organ that are most associated to the Western endocrine system. And in biomedicine, the endocrine system is in charge of regulating and producing hormones. So the kidneys in Chinese medicine are the ones that control growth, reproduction, development, And what we talk about in biomedicine is the HPA axis. So that's the hypothalamus, pituitary, adrenal, and thyroid. But in TCM, we're focusing on the kidneys. So it's critical that we really want to regulate the kidney system in Chinese medicine. So hormone balance can most be explained in Chinese medicine. It's very closely related to the concept of yin and yang. So this is a Tai Chi symbol. And what this is the yin represents substance, and the yang, the dark part, represents energy. So the yin and yang relationship in Chinese medicine, they're very important. And they depend on one another to function. So you can't have one without the other. And they have to balance, they have to be in balance. And if you tip the scales a little bit one way or the other, it could just throw everything off. So in Chinese medicine, yin and yang theory, they're based on 4 principles, which is opposition, interdependence, mutual consumption, and intertransformation. So interdependence, so all parts contribute to the whole, giving us a holistic view. So there's 2 parts of the yin and the yang, the Tai Chi symbol, yin and yang. So they also they're interdependent, but they also rely on each other. So one cannot exist without the other aspect. So you have to basically keep these 2 separate components in balance with each other. As I mentioned earlier, yin is the substance, that is the white part, and that is the part of the body that is responsible for cooling and calming energy and providing fluids and substance in the body, where yang is the more energetic, outward, high intensity part of our bodies. So the yin hormones in our body can be thought of as the metabolizing functions of the body. So an example of a yin hormone would be estrogen. And so that's providing substance to the body. And a yang hormone would be more like progesterone, which is warming, metabolizing. So it's important that these 2 hormones are in balance, Western speaking. So I'm going to focus more on the yin and yang part for Chinese medicine, though. So when one, if yin or yang is either deficient or one is in excess, imbalance can occur. And you can have symptoms such as acne, menstrual irregularities, infertility. You can have erectile dysfunction if you're male, or low sperm count, insomnia, breast pain, headaches, you name it. That's how it can look like if there's too much of one or not enough of the other. So just to give you all an example, so let's just say a woman who loves to exercise and work out, and she can have too much yang in her body. And basically what she's doing is she's putting a strain on her adrenals, right? Her kidneys and adrenals. So she can, have too much cortisol going in her body. It could just be draining her estrogen levels because there's too much yang. So she's just feeling tired all the time, and she has low libido. So that's not uncommon for someone who works out, like an athlete, like a woman who's, you know, using too much yang. And then eventually her period will stop, right? And then on the other end of the spectrum, we can see if there's too little substance, like if there's yin deficiency, not enough substance, such as estrogen, once again, even though there's the yang's sufficient, if there's not enough substance or yin, you can still not have a period, and you can still have ovulation problems. Or we see that a lot with menopausal women. It's because there's not enough yin substance. So you can have an imbalance in either yin or yang, but it can look the same. It can manifest as the same symptoms. So that's why it's really important to see a Chinese medicine practitioner, so they can determine which is the issue, you know, too little yin, too much yang, you know, what's going on. So that's why the hormone imbalances are treated differently with Chinese medicine. It's just not like you go to your primary care physician and they just write you a script for estrogen or, you know, progesterone. So not one size fits all. So rather than replacing the hormones like they do in Western medicine, in Chinese medicine, what's really, really important is Chinese herbal medicine. So what TCM does is it encourages the body to produce the necessary hormones that are required so balance can occur naturally, so it can be restored. So instead of pumping you full of hormones like they do in biomedicine, the idea behind Chinese medicine in treating hormone imbalance is to encourage the body to produce hormones on their own. So, you know, we see this a lot with postpartum women or perimenopausal women or women who have gone through menopause. But you also see it in men as well. Like, you know, it's not just, this is not just, you know, about women. It can happen to men too. They can have hormone issues as well. So what would be great is if you are experiencing hormonal imbalance is to have a consultation with a licensed practitioner who practices Chinese herbal medicine, and then they can customize and prescribe a formula that is based on your body constitution, as well as your presenting signs and symptoms and your overall diagnoses. But just in general, the Chinese herbs that are used to balance hormones and strengthen kidney function, nourish blood, nourish yin, the substance we talk about, which is really responsible for, you know, balance in hormones in the body. I'm just going to go over a few of these Chinese medicine herbs, and they're not meant to be taken on their own. Like I said, I stress it's very important that they are used in a formula that's specified for your particular differential diagnoses. So I just thought that'd be fun to talk about. And they're pretty common. You can find a lot of these like in a Chinese grocery market. So it's kind of cool because a lot of them are food. So the first thing is goji berries. So in Chinese medicine, it's called gochisa, and they are great for nourishing blood and yin, that substance that is vital for a healthy endocrine system. So it's also a great herb for the eyes as well. And so it's really, really nourishing for blood and yin, blood and substance. Another Chinese herb that is great for women's health in particular is donghui. And that is nourishes blood and substance again, but it's also very rich in phytoestrogens. So it really, really helps regulate those hormone receptors. So you will see that used a lot in women's formula to regulate periods, and also in menopausal formulas, also to build uterine linings. I've seen that herb used a lot for that. The next herb I want to talk about is shan yao, and that is Chinese wild yam. It's this huge yam, and you could find these in the Asian markets. They're really, really cool. But that is really good for actually the yang energy. So it really helps with progesterone levels. So you would select that herb if you want to increase yang or progesterone. And it's also really, really good for strengthening the digestive system. So a lot of Chinese herbs, they have not only one function, but they have multiple functions across the board. So Chinese wild yam is really, really good for spleen, stomach, but also great for kidneys. Another herb is the white peony root, and that's called bai xiao. And that's great for regulating menses. It's great for nourishing the blood. And it's really, really found in a lot of formulas that just calm the nervous system in general. So it's just really, really a soothing, great herb. And you'll find these in a lot of formulas for hormone balance. And the final herb I want to discuss is ginseng. And we want to talk about the Chinese ginseng and not the Korean ginseng. There's a huge difference. The Korean ginseng is super, super hot in nature, and it just will cause, it's too much yang, and it will just cause things just to go out of whack. So, you know, that's why it's so important to talk to someone who is experienced with herbs and a licensed practitioner, so you can, you know, get the right herb in your formula for hormone balance. So ginseng is great for increasing, like I said, yang. So progesterone, once again, it really helps with energy levels. It helps calm the nervous system. It's great for digestion as well. And so many people, especially in China, they just will sit around and drink ginseng tea, or you can take it as a tincture as well. But you just have to be careful with this herb because ginseng is very strong, and too much could be too much of a good thing. You know what I'm saying? So you just have to really, really, you know, get the correct formula. It's prescribed on a case-by-case basis, and they're customized to you. So that's why it's really important to see a Chinese medical practitioner like myself or Dr. Kelsey, just to get the right, you know, formulations. So that's how Chinese medicine, herb-wise, can really, really help bring hormones back into balance. That's only one component. There's also exercises. Acupuncture is another great modality that can bring hormones back into balance through regulation of key mediators within the body. And there's no side effects. That's the wonderful thing about Chinese medicine. You don't have side effects with the herbs or, you know, with acupuncture either. So acupuncture is really great because it is specific to hormonal balancing, and it acts on the HPA axis. And for those of you that don't know, the HPA is the hypothalamus pituitary axis. And Dr. Kelsey is going to go more into that, but it's basically the brain's master controller of hormones function. So, and acupuncture stimulates the HPA. And when the HPA is stimulated, beta and endorphins are released. So, and also other neuromodulators are released. So that's why it's really has a direct effect on the central nervous system. It has a direct effect on the HPA, reducing cortisol levels, elevating serotonin levels and estrogen levels. So once again, the same with the herbs, the treatment and the point prescription is going to be on a case-to-case, basis. So that's why it's really important to come in for a consultation so we can address your specific issues to hormone imbalance. So, so yeah, I think Dr. Kelsey, you're going to talk more about the acupuncture portion and things that people can do at home, like some acupressure points, which are great.
Yeah. Yep, exactly. Thank you for sharing, Dr. Karen. I loved your description of the symbol of the yin yang Chinese symbol.
Yes.
Like the concept of like nothing is perfect all alone, right? You have to have this balance, and you always have, like, that's why they have the circle in the white area, is because nothing is all one thing and nothing is all something else. And
Right.
so I don't know, I just love that philosophy and that theory. It's probably one of my most like favorite concepts in an image. So
You
I
could
have,
really write a whole research paper on it.
yeah, you really could.
Really
It's
fun.
it's
It's
cool.
yeah, it's very cool.
Yeah. So like Dr. Karen said, I'm going to go over that HPA axis just a little bit more, not a lot more. You actually hit it quite well. But the HPA axis is basically that link between the hypothalamus, the anterior pituitary, and the adrenal cortex. So when you have a lot of cortisol produced in the adrenals, you get this like negative feedback loop to the hypothalamus. So basically, words that I just said in layman's terms are when you're like overstressed and you're having that adrenal fatigue and you're not sleeping well and you're just, pushing, burning the burning the flame at both ends or whatever, and you're really working a lot. That could be working out, that could be taxating your brain, that can be a lot of things, as Dr. Karen was talking about, that can affect your system. When you start doing all of that, it throws off this axis and it throws off the body's signals. The stress signal of our body is an immediate danger reaction, right? So if you're stressed, your body wants to go into the survival mode because obviously living is going to be more important than reproducing. So your body goes into this whole survival mode where cortisol needs to be upregulated, the stress hormones need to be upregulated, and that's when people's testosterone and estrogen follow, like on the other side of that like diagram, basically kind of fall off and get dysregulated. A lot of times when people have high cortisol, they're like, well, you're supposed to have some cortisol. Yes, you are supposed to have some cortisol. You're supposed to have cortisol first thing in the morning when you wake up. You're supposed to have another like kind of up, like dip up, like after lunch in the afternoon. And so yes, you want cortisol. I'm not saying it's a bad thing, but I'm just saying everything in balance is what you're really wanting. And that's where Dr. Karen was talking about like Chinese medicine and how that helps find the root cause versus just giving someone more estrogen and not fixing the root problem of this negative feedback loop to the hypothalamus. And so that's where acupuncture is very key in the whole process. Because of that, I actually wanted to talk about some more supplements. So I know Dr. Karen went over some supplements, but I'm going to go over more Western supplements.
Well, Dr. Kelsey, can I just say something? Those are more herbs that are used in formulas. So you're not being redundant because these are actually supplements that you supplement You can supplement to your formula, or you can supplement to your diet. So they're kind of two separate things. Yeah.
Oh yeah, for sure. For sure. Two separate things. I would say the ones I'm going to go over now, you definitely want to talk to a medical practitioner if you're going to be adding them into your daily routine, especially because you don't want like reactions with medication or anything like that. So definitely ask, but these ones are a little bit more normal, and I'm sure a lot of you guys have heard of some of these. So I'm going to go over some supplementation that you can easily just pick up out and about. The first one is ashwagandha. I'm sure that everybody has heard of ashwagandha. It is an adaptogen. So what that means is it adapts to what the body needs. It's very good at its job, sometimes too good, and it adapts so well that I tell people not to be on ashwagandha for longer than 6 to 9 months, and then do like a couple week break and then go back on it if you would like, just because your body does adapt. It adapts to you and you adapt to it, and then it becomes less potent. So that's kind of one of my tips and tricks about ashwagandha. It helps the body adapt to changes of the daily life. It helps support your immune system. It helps balance the mood and a feeling of well-being, while it's also anti-aging. So this is going to be important for those stress levels like we were talking about. So does it directly affect your hormones? Not necessarily, but yes, because it's helping decrease that stress. And when that stress decreases, your hormones can then balance themselves out. And then black cohosh was the second one I have. So black cohosh is known to help with hot flashes in menopausal women. And like Dr. Karen said, just because you have hormone dysregulation does not mean you're necessarily only female. Men 100% go through something called andropause. So when you have andropause, you're going basically through the same symptoms as women go through, but it's less talked about. So you have that same less hair, you start to lose the muscle mass, maybe you're gaining a belly a little bit, your metabolism decreases. They'll also have hot flashes at night. So hot flashes at night is a very yin symptom that me and Dr. Karen recognize, but they'll start to have, you know, like less sleep, maybe low libido, erectile dysfunction, everything Dr. Karen mentioned earlier. So is menopause the only thing that you know you can help with? It's no. Andropause is also, you know, something that we can affect. The next one that I had is actually chaste tree. Chaste tree. I know sometimes people think I'm saying one word, but it's two words. And it helps support a healthy prolactin and progesterone level. So this is going to be more for the people that are still menstruating, people, you know, that are just starting. It's going to help with PMS symptoms. So whether that is going to be your mood, if that's cramping, if that's irregular bleeding, it's going to help normalize that menstrual cycle just a little bit. So that is my last one that I was going to hit. So I kind of got one for like each area of the system, basically, that I was talking about. As for exercise,
acne too, Dr. Kelsey.
what?
That's great for acne too.
Yeah.
Hormonal acne, the Vitex, the chaste tree.
Yeah. Yes, because it's helping all those PMS symptoms, you know, that's one of them. So like sleep, dream sleep, and all of, you know, all of that, all those things. So and I wanted to go into some exercises now that you guys can do at home to help bring energy to that area of the spleen and the kidney. So Dr. Karen was talking about kidney is our big hitter. Like this is the one that you're really focusing on when you are working on Chinese medicine and balancing you know, hormones and regulation and that sort of thing. But she also mentioned spleen and stomach. And so I'm going to kind of go over today both the kidney. The kidney is the main thing, but I'm also going to show you guys a spleen exercise and a spleen acupuncture point to hit at home, just because those are like the top two that you guys should focus on. So for the exercise for the kidney, is actually just a forward bend. So just, you know, sit on the ground, put your feet straight out, lean forward, and bend forward. You can put one leg to the side and lean forward. So both of these meridians, where they start and where they end is actually, they go up through the inner of your leg, basically. So they start on the inside of the foot and they run up the inside of your leg and kind of end on the abdomen. So it's going to be key to stretch that inner thigh, that inner leg, and all the way down to the toe. And that's where this forward bend comes in, and potentially sticking one leg out and then bending, because that's going to get that medial leg more. So that's your main kidney one. Your spleen one is actually going to be, you're gonna like kneel on your knees. So you're gonna put your knees on the ground. If this one's a little bit more difficult to do. So if this is gonna be uncomfortable for you, do not hurt yourself. I know there's some people, tell them an exercise and they'll be like, I'm supposed to be doing it. Then like they end up hurting their knee or something. So only do this if this is comfortable for you. Don't hurt yourself, but you're gonna be kneeling on the ground. And you're basically just going to lean backwards. So it's going to stretch that front part of your quads. And the further back you lean, the more it's going to go down your leg. So it's going to go all the way down. And eventually, some people can lay flat on their back with their knees kind of bent underneath them. So like I said, only do this if you can. I know that position and arching your back hurts people's low back, and I know it can hurt your knee. So be careful. But those are the top two for your kidney and spleen exercises. As for acupuncture points, like Dr. Karen was talking about, we're actually going to do kidney 3, or yes, kidney 3. So kidney 3 is located on the ankle. I'm sorry that I don't have a picture right here with me. I do believe that Dr. Abby has them, like pictures. I've seen pictures in the past. I'll make sure that something is attached, so that way people can kind of see where these are at when the blog goes out. But basically, kidney 3, if you feel the inside of your leg here, so if everybody pulls up, I know no one's on the call right now. Sorry, I just kicked my desk. And so you're going to feel the inside of your leg. So on the inside of the leg, there's this bony prominence right there. That is called the medial malleolus. So what you're going to do is you're going to find that bone. It's right where your ankle joint bends and moves around. And the back side of your leg here is the Achilles tendon. So halfway between that bone and the Achilles tendon is kidney 3. So an easy way to do that is to like pinch your Achilles tendon. You can pinch both sides, and you're actually going to be hitting a ladder point at the same time. So why not? Why not hit both sides? That's where kidney 3 is at. It's going to be very important to massage. We've talked about it in the past. Massage for like 30 seconds or so with moderate pressure, and do that a couple times a day. That should really help. Spleen 6 now is going to be the 4 finger widths up from that medial malleolus. So then again, feel where that bone is on the side of your leg. You're going to take 4 finger widths, put your pinky just on the upper part of that bone, and it's where your pointer finger lands about. And feel around. You can move your finger around. It's going to be tender on most people because most people have spleen and stomach problems with today's diet and today's lifestyle and today's stress. So that's probably going to be tender on everybody. So if it's not tender, good for you, or you might be in the wrong spot. So definitely feel that like middle leg here to see if you can find the spot. When I teach acupuncture, I tell my students, I'm like, if this point's not sore, you're not in the right spot. Because
it's very sore. Yeah.
yes, especially on students, and after like, going as long as we do when I teach, that I'm like, if this isn't sore, you're not in the right spot. But kidney 3 and spleen 6 are going to be huge, and they're huge to help regulate your hormones, but also if you're having like menstrual cramping, that sort of thing, spleen 6 can definitely help get rid of those cramps without having to take, like a Midol or an ibuprofen or a Tylenol or something like that, because we can't tell you to take those. And if you're wanting to do it in a more natural way, this is the point to hit. If you are pregnant, like currently actively pregnant, please do not hit spleen 6. Okay, so then other modalities that we had, so that's kind of what's on our wheelhouse, but other things that I can give you guys to do at home is there is a book called The Younger You by Kara Fitzgerald. That's going to be a really good book for anti-aging and helping regulate your hormones in that way. And then bioidentical hormone therapy is something else that I wanted to bring up. It's really new to the market. There's only one place that I know of and that Dr. Abby knows of in the Kansas City area that actually does it. It's Dr. Mirabli. He's in Overland Park, but it's bioidentical hormone replacement therapy. So this is out of our wheelhouse, but this is when you would go to a naturopath or a medical doctor that's doing more natural remedies. And basically what this is, it's like we were talking earlier, it's basically introducing estrogen into your body, but instead of just taking an estrogen pill, it is bioidentical. So it's going to match your body's system and not a fake pill estrogen. So it's a little bit more better for your body. So that's what we recommend is Dr. Mirabli in Overland Park.
Aren't they usually applied like on your skin, like in your elbow or in your back of your
Yeah,
knee?
I mean, I can speak on that
Yeah.
because I've taken them before. So, I was a marathon runner, and a lot of people think that they're just for menopausal women, but they're for people at all stages of life. And I mean, especially like the men, like you're talking about with andropause, people start to decline at 30 and on average with their hormones. But if you're really exerting your body, you're an extreme athlete, you can totally tank your hormones. And I'm raising my hand because I did. And I just felt horrendous. And my hair was falling out. My skin was not good. My energy levels were just in the tank and my motivation was zero. And so I went and got blood testing and everything was fine. But then I got referred to Dr. Mirabli in Kansas City, and they did my hormone panel, and my testosterone was in the gutter. And I mean, with women, you don't think about testosterone, but it's such a vital. I mean, they're all vital: estrogen, progesterone, testosterone. I mean, you have to have the balance. And so what they do, and I mean, I took what's called a troche, so it's a dissolvable in your mouth, but you can do a cream that's on top of the skin. And then you can also do an incision in the glute. So that's the fastest way to administer the hormones. But for me with the troche, it was about 2 weeks. And just, again, that's like Dr. Kelsey said, it's out of our scope of practice, but I think it's important that everybody knows about it. They're yam derived, so it is naturally derived. And so yeah, so I just wanted to kind of interject on that. And then Younger, and I don't know if Dr. Kelsey was going to speak about this, but there's a book called Younger by Suzanne Summers that I think everyone should read. There's lots of Harvard MDs in that book, and they speak on that. And the whole gist of the book is that you can feel better with age. It doesn't have to get like, I mean, just better and better and better with age. So that's always a great resource. So throw it over to you, Dr. Kelsey, if you have anything else to add on that.
I think that was about it. So
Yeah.
that was what I was finishing up with since, we can't really do it, but I wanted to give the resource. So thank you for adding.
Yeah, absolutely. I think the key with hormones, and with aging in general, it's an attitude. And I think it's just such a mindset too. And if you do these things like what both of these women have spoke about and just these preventative measures, you can feel so much better. You can support your biology and your body, but then you also have to, truly make a decision in your head about, hey, I want to feel the best that I can every decade. Every decade it's better at 50 than I was at 40, better at 60 than what I was at 50, and I think that's what we do here at Sacred is how, we really try to invite people to develop that with their own lives and however that looks, another book, Goddesses Never Age by Dr. Christiane Northrup. She is amazing. She was an OB-GYN turned integrative medicine practitioner, and she's just for women that are looking for, and I know we're talking about women, but I mean, anybody that's looking for that kind of a mentality, she's a great doctor. But it's mindset, biology, and there's the magic. So I just want to thank both of you. I think this is really a great resource. Dr. Karen, do you have anything else to add?
No, I mean, if you do want to find out if you have imbalance in hormones or what your cortisol levels are, is it peaking at 3 a.m. when it's not supposed to be, or is it peaking, you know, at 6 or 7 a.m. when it's supposed to be? It's best to see a naturopathic doctor, an ND, and they, or, you know, or equivalent. And adrenal, it's called adrenal stress index test. It's called ASI. That's a great, great panel of testing to do, just to make sure that your cortisol levels and your estrogen and progesterone and testosterone, and, you know, that's a good place to start. And then they could, you know, lead you in the right direction. You could always make an appointment with me here at Sacred Spa and Wellness in Saratoga, you know, to talk about herbs and acupuncture, what we could do for you there, or reach out to Dr. Kelsey in Kansas City. So, you know, there are resources out there, and you just need the right testing just to get to see where you're at. And I just think that's the really important part, is because, like I mentioned earlier, different, I don't want to say diseases, but different reasons of why you are presenting with symptoms. You could have the same symptoms, but different reasons why that's occurring. So it's important not to just go off of symptoms, but to actually do the baseline testing and see where you're at.
100% agree. Good way to put it, Dr. Karen.
Yeah.
Well, thank you everybody for joining our Talks with the Docs for July. I know July is almost over, and we will see you all in August.
Yay. Everyone have a great, happy Saturday.
Thank you.
Thank you, everyone.
Bye.